So obviously we can adapt to some of this. We've got already quite good responses to malaria, for example. Malaria, we're doing quite well on a global scale. But are there limits to how much we can adapt? Well, there are. Of course, there are physical limits. Some places, like low-lying islands, like the Cayman Islands, for example, would have difficulty in adapting or impossible to adapt to sea level rise. There are behavioural limits. People don't want to leave the cities where they're familiar with, just as those people who were affected by Hurricane Katrina didn't want to leave New Orleans because they had profound cultural roots there. And there are technological limits. For example, the Thames Barrier in London probably won't protect London from increased flood risk adequately by the middle of the century, and that will need to be superseded or replaced by something better. But at some point, we'll reach those technological limits to adaptation. What do we need to do to avert dangerous climate change? These are the kind of emissions trajectories, the greenhouse gas emission trajectories that we would need to go through if we wanted to try and prevent 2 degrees warming, going above 2 degrees warming, which many climate scientists think is important to reduce the risk of some of these more serious impacts. And this shows you some of the dramatic reductions that we'll have to make in greenhouse gas emissions depending on how long we leave it. So the longer we leave it to cut, the deeper the reductions will need to be. And of course, it looks very unlikely that we're going to peak at 2011, and therefore if it goes on rising, we will have to make truly draconian cuts if we're going to avoid that 2 degree centigrade limit. So that's beginning to look rather unlikely. In the case of a country like the UK, our Climate Change Committee has said that in order to play our part in reducing greenhouse gas emissions, we would need to reduce by at least 80% by 2050. So that's our current emissions, 700 million tonnes of CO2 from all these different sectors. And we would need to reduce that down to about 160 million tonnes of CO2 equivalent. That's quite an arduous target, but probably that's too conservative. We probably need to move even beyond that. So that will be quite a substantial challenge to our economy to do that. But there is an upside to all this. There are a number of benefits to decarbonising our economy, to moving towards cleaner, non-fossil fuel based sources of energy, and to reducing unsustainable emissions from other sectors as well. And a recent series of articles that we did in The Lancet at the end of last year, when I say we, I mean a group of 55 scientists, 55 scientists from 9 countries, did in The Lancet last year, examined in 4 sectors how we might achieve near-term benefits to health whilst at the same time reducing greenhouse gas emissions quite substantially in these 4 sectoral areas: household energy, urban land transport, food and agriculture, and electricity generation, all important areas for the production and emission of greenhouse gases. And we modelled the impact in these sectors of health effects to reduce greenhouse gas emissions by 50% in developed countries by 2030, which was sought to be on the trajectory for getting an 80% reduction by 2050. So along the line that we need to, that probably rather conservative line that we need to follow. Now in household energy, we looked at 2 case studies. One was in the UK, looking at a programme of retrofitting our current housing stock, much of which is obsolete, with more insulation and energy efficiency. And we also looked at the impact in a low-income country, in this case India, of replacing their very inefficient cook stoves with much more efficient cook stoves. And the reason that's important is because even though these stoves burn wood and dung, they still contribute to the greenhouse effect, because some of the pollutants that they produce, ozone, for example, which is a greenhouse pollutant, and black carbon, which is also a greenhouse pollutant, contribute to global warming, as well as producing all sorts of near-term health effects. What we found in our UK programme of retrofitting these houses, and that means improving their energy efficiency, switching them from fossil fuels to electricity generation, so reducing sources of carbon monoxide in the house, for example, improving the ventilation system for those houses that were tightly sealed and therefore might have problems of build-up of indoor air pollution. So putting in modern and energy-efficient ventilation systems. We found that altogether, if you put all of those together, you could perhaps save about 5,000 deaths a year as a result of reductions of exposure to indoor air pollutants, including environmental tobacco smoke, radon gas and other indoor pollutants, as well as an improved indoor environment in other respects. And that would save 55 million tonnes of carbon, which is really quite a substantial amount. It's about over 30%, 36% of our household emissions of greenhouse gases. So well worth having. It would cost quite a lot of money. I understand you've had a recent unfortunate experience of your insulation program here, and as you know, these programs need to be planned properly, and these insulation and other modifications need to be done by competent people. But they can have a very major effect on greenhouse gas emissions, and we believe also useful impacts on human health. If we look at low-income countries, the challenge there is to replace these very poorly functioning traditional stoves with these modern stoves here. You can get dramatic reductions in indoor air pollution. You can get 15 times reduction in black carbon and other particles, 10 times reduction in ozone, and 5 times reduction in carbon monoxide. So you can they can perform almost as well as gas stoves with these new technology with an electric little blower fan which improves their combustion efficiency. And we showed that in our modelling, which I don't have time to go into detail about, in India, by replacing 150 million stoves over 10 years, which is a feasible program actually, you could save about 2 million lives using that stove program, from acute respiratory infections in children, chronic obstructive airways in women, disease in women, and ischemic heart disease. So really quite a major public health benefit from replacing these kind of stoves with something like this. We also looked at the urban transport sector, and we looked at Delhi and London. I'll just mention our results in London. In London, well over 50% of our car trips are very short distances, and at least historically, very few of them have been by bicycle, although that has changed in recent years. And we looked at the benefits of developing a low-carbon transport strategy, increasing cycling and walking. We looked at the benefits to health of doing that, the impact on road accidents, and the impact on air pollution of changing our transport strategy. And what we found, looking at quite a radical strategy to get people out of their private cars, onto bicycles, walking, also to improve the energy efficiency of those cars that did remain, so there were much more energy efficient cars. If you put all that together, you get substantial reductions in ischemic heart disease, in stroke, dementia, breast cancer, also not on this slide, diabetes as well. Obviously obesity is reduced as well. There is likely to be some increase in road traffic crashes, but these are very small numbers of death compared with all the benefits. So they're completely more than counterbalanced by the very large number of benefits that you're likely to see accruing. And of course, these road traffic crashes can be reduced further by better policies to separate cyclists from road traffic and separate them particularly from heavy goods vehicles, which are the major killer, of course, of walkers and cyclists. Again, that would result in quite radical reductions in greenhouse gas emissions if we could implement that strategy, which calls really to get people out of their private cars for short distance, for short journeys, onto cycling and walking, and where they are using their cars, to use much more energy efficient and less polluting cars. And interestingly enough, it was the impact of active transport that had a much bigger impact than the reduction in air pollution. It's still worth getting, but it's the benefits of active transport that really seems to have a real impact on public health by reducing these major diseases, according to a number of systematic reviews that we used at the basis of our work. Thirdly, we looked at the food and agricultural sector, and here we looked at the kind of reductions you could get in greenhouse gas emissions from the agricultural sector. It is thought in many countries about 80% of total emissions are from livestock production, particularly from ruminants because they produce methane, which is a potent greenhouse gas, but not just from that, because also in some countries we're seeing deforestation to grow soya, to feed chickens or pigs, and that can be a potent contributor as well. And so there doesn't seem much doubt that from a global perspective that high producing and consuming countries will need to reduce their consumption of animal products if we're going to converge on a lower all-round level of consumption, a sustainable level of livestock production and consumption. And we found that technological advances could reduce emissions to some degree, but they wouldn't give us the kind of emission reductions that would be needed to reach these targets. And so therefore, we looked at the impact of reducing animal product consumption, and particularly reducing animal source saturated fat, which would result in a reduction in heart disease deaths by about 15%, depending on what assumptions you make about how you replace that saturated fat in the diet. And finally, we looked at electricity generation. Obviously, we generate our electricity today largely through fossil fuels, and we looked at a 2030 business as usual strategy with no constraints on emissions, compared with a 50% reduction from 2000, using less coal, more low carbon sources, and we estimated the reduced deaths from cardiopulmonary disease as a result of reduced particulate air pollution. And we showed that in the cases of India and China, because they have higher air pollution levels, you would get very substantial reductions in premature deaths because of this reduction in air pollution. And in the case of the EU, where obviously they have much tighter pollution controls, you get less, still a useful number, about 5,000 premature deaths reduced per year, prevented per year, but obviously less than these more highly polluting societies. So substantial potential benefits, and the cost or the benefits would partly offset the kind of costs of these mitigation strategies. So for some countries, in the case of India, for example, the benefits from doing this might well outweigh all, or perhaps at least most, of the costs of these kind of technologies. So I think what we can say in conclusion is that the impacts of climate change will fall most heavily on the world's poorest people, but the effects will be global. We'll all experience these impacts. We will need to adapt to climate change as far as we can. We won't be able to adapt to all of the adverse effects, but we also need to reduce greenhouse gas emissions. And in reducing greenhouse gas emissions, a cleaner society, more reliance on renewable energy and other clean sources, and more sustainable ways of living, we can actually substantially improve public health. So I think, on the whole, that's a positive message and suggests to me that although there are real dangers in climate change, there are also potential really major opportunities for public health in aligning itself with climate change policies. So thank you very much for listening. This work was not my work, it was done by many other people around the world. And if you want to know more about it, please read the papers in The Lancet towards the end of last year. Thank you very much indeed.
Well, thanks, Andy, for that tour de force on climate change and health. And I think Andy's set us a very big challenge for the next 20 years of public health here in New South Wales to grapple with these issues and respond with effective public health and indeed health promotion action. Andy, it's been terrific to having you with us in Australia for the FENA conference at the Academy of Science last week, and indeed later this week on the Gold Coast for the first international conference on climate change adaptation. On behalf of the New South Wales Health Department and the Faculty of Public Health Medicine within the College of Physicians, which is also celebrating 20 years at this time, please thank Andy once again.